Hello, my name is Madison Carter, and I'm a certified coding instructor. I've been working as a medical coder for a decade now, but I still remember exactly what it was like when I was getting started. I spent a lot of time researching the industry, wondering if coding was right for me. I couldn't afford a college degree, but I still wanted to try for a skilled, high-paying job, and after putting in the hard work to study, it all paid off. Being a medical coder has changed my life for the better. Over the years, the financial freedom and stability of my work as a coder has allowed me to live my life the way I dreamed. A lot has changed over the last 10 years, but the questions people ask me about getting into medical coding haven't changed a bit. So today, I'm unlocking this free Intro to Medical Coding course to hopefully answer many of the questions you have about medical coding and whether it's right for you. Hello and welcome to Intro to Medical Coding. My name is Madison Carter and I'm going to be your instructor today. Today we're going to cover a few topics that are important to consider if you're still trying to decide whether or not you want to be a medical coder. A lot of people outside the industry have a misconception that coding is simply staring at a computer all day and picking a few codes out, more or less at random. But coding and the healthcare industry as a whole is a bit more complex than that. So today I want to talk to you about how healthcare functions as a business and how money is collected for services rendered, how different types of medical providers factor in, the different types of payers or insurance providers, and how medical coders fit into all of this, how you can break into the industry, and how you can move forward on a new career path. Now, I'm sure you probably understand how a doctor's office works from the patient's perspective. You schedule an appointment, you show up at the scheduled time and see your doctor, and that medical provider gives you their opinion and sends you on your way. If you had insurance, you likely gave your insurance card at the front desk and paid a few dollars up front, but your copay may not be all the provider is owed for their services. Nobody wants to work for free, so it makes sense that the provider wants your insurance company to pay the remaining balance due. This part isn't quite as simple as just sending an itemized statement to the insurance company and calling it a day. Once you leave the office or clinic, the provider will write detailed notes describing what he or she spoke with you about and what was decided during your visit. These notes, also called chart notes or simply documentation, are then passed along to coders and billers who work to collect payment from your insurance company. Coders will read through the documentation and assign standardized procedure and diagnosis codes that will be applied to an insurance claim form. This way, the insurance company's computers can easily read and understand the claim form to process a payment or a denial. If a claim is denied, a biller will step in to help resolve the issue. All of these tasks that are going on behind the curtain are part of the revenue cycle or the business side of healthcare. This side is not focused on providing medical care, but instead focuses on receiving payment for services rendered. Different clinics and professionals may have slightly different ideas of how this revenue cycle chart should look, but the basic steps are still the same. A patient's demographic and insurance information are collected. The services performed are captured, typically in an electronic health record software. A claim is prepared and submitted, and a response from the insurance company is processed. If needed, claim denials will be resolved and patients may be billed for any remaining balance due. Now, let's look at some of the staff members you'll find in a clinic. Within any healthcare facility, you'll generally have a variety of different people providing medical care to patients, and we call these individuals providers regardless of their actual credentials. This is because they're the people providing medical care, whereas others, like coders, are assisting in the revenue cycle but not providing direct medical care. Providers fall along the hierarchy based on their education level. At the very top, the highest educated, are physicians, also known as doctors. These providers have obtained either a medical degree or Doctor of Osteopathic Medicine degree after completing college, medical school, and a residency. Residents also hold an MD or DO, but they're essentially physicians in training. These providers are actively completing their residency requirement, which is a postgraduate training period of between 3 and 7 years, depending on the resident's chosen medical specialty. A fellow or a physician in a fellowship are physicians that have previously completed a residency and are now training for a subspecialty, such as neurosurgery. Mid-level providers are physician assistants and nurse practitioners. The providers have completed at least 4 years of college and then either a physician assistant program or a master's degree in nursing. Depending on the state they practice in, they may complete only some or most of the tasks that a physician can complete. Last in the hierarchy, but definitely not least, are individuals such as technicians, licensed therapists, nurses, etc., that all have varying educational requirements and specific tasks that they're responsible for. As we know by now, providers are responsible for providing medical care, but someone needs to take care of the business side. This is where revenue cycle staff play an important role in keeping a clinic up and running. Registration staff generally help at the front desk. These staff members don't just answer the phone and take co-payments, they're also responsible for collecting accurate patient demographics and verifying active insurance coverage. Very busy clinics may also have registration staff at a checkout desk to collect payments and schedule the patient's next appointment. Registration staff play a crucial role in the first step of the revenue cycle. Not only that, they're often the first friendly face a patient sees when they enter the clinic. Coders read medical chart notes and assign appropriate CPT, HCPCS, and ICD-10 codes to the patient's medical record. The selected codes are primarily for the use of filing insurance claims. By using standardized code sets, claim submission and processing are significantly more efficient, which leads to faster reimbursement. Billers are responsible for submitting claims to the insurance company, also known as payers, as well as managing any claims that are rejected from processing or were denied for payment. They often contact the payer directly and file appeal requests for denied claims. Billers are also assigned to other important revenue cycle tasks, such as posting payments and remittance, managing credit balances and refund requests, and analyzing trends across the revenue cycle. Collection staff receive payments from patients, and this area is often a starting point for new billers. Small clinics may ask their billing or registration staff to collect payments rather than employing dedicated staff members. Staff in all of these departments are working together to support the business side of healthcare and are just as important to keep a clinic running as doctors and nurses. Without funds to keep the lights on and supplies in the cabinets, the clinic can't keep supporting patients in its community. Now, let's take a brief look at payers, since they're the reason coders and billers are so important to the clinic's revenue cycle staff. There are a variety of different payers that will cover health insurance claims. We generally group them into two categories, commercial or government. Commercial payers primarily include standard health insurance plans that one can purchase on the marketplace or obtain through their employer. Big names are Blue Cross Blue Shield, United Healthcare or UHC, Aetna, and Cigna. Also included in this group are workers' compensation policies, auto insurance policies, Medicare supplements, and cost-sharing programs, which are usually sponsored by a church or other organization that collects money into a pool to pay back its members for healthcare expenses. On the other side, we have government payers, which includes Medicare, Medicaid, the Children's Health Insurance Program or CHIP, and Veteran Affairs, which includes TRICARE and the VACCN. These are programs sponsored by the federal government. Medicare is broken down into 4 parts. Part A covers inpatient hospital expenses. Part B covers many office visit and outpatient hospital services. and Part D covers prescription drugs. Part C is also known as Medicare Advantage, which allows commercial insurance companies like Humana and UHC to offer Medicare plans with additional benefits and often combines Parts A, B, and D into one monthly premium payment. Advantage plans usually offer additional benefits as well, such as gym memberships and nutritional services. Medicaid also offers a similar program to allow commercial health insurance companies to offer enhanced benefit plans. These are based on the individual states that contract with the payers. Since we're here to focus on medical coding, let's look at documentation in the medical record and how a coder's day revolves around it. A coder's main task is to take what's written in the medical record and turn it into standardized codes. Most of a coder's day is spent reading, either reading documentation to understand it deeply, or reading coding guidelines to help them select the most appropriate codes to report. Good reading comprehension is an important skill to start with. The medical record itself is made up of provider-written notes, test results, imaging, medications, and treatment plans regarding a single patient's past and present illnesses or medical conditions. The record should document everything done to and for a patient and why. Notes should also be as specific and detailed as possible. Most medical records today are stored within an electronic health record, either an EMR or EHR database. Very rarely will you come across a clinic still using primarily paper records, though some clinics may still keep paper records from decades past. EHR software does a lot more than just store medical records, though. Most revenue cycle tasks, from reporting codes to filing claims to posting payments, can all be completed within an EHR system, which helps to connect each individual department within the revenue cycle. In addition to good reading comprehension, medical coders should also start their learning journey with a solid foundation in medical terminology and anatomy. Because most providers write their notes for themselves and other providers, you won't often see lay terms in medical records. Knowing the lingo is an important first step for new coders. So let me ask you this. What do you think are the two most important reasons for documenting and maintaining a patient's medical record? If you thought to facilitate ongoing medical care or to provide documentation of services rendered for coding and billing, both of these answers are correct. It's very important that a provider's documentation be thorough and accurate in describing what was done to or for the patient and why. It's not a coder's job to create documentation. However, it is part of their role to request additional details if the provider's notes are not clear enough for them to make an accurate code selection. A good rule of thumb we like to use is if it's not documented, it didn't happen. There are two main types of notes that are found within a patient's medical record, and the first of these is the most common. Evaluation and management services are office visits with a provider. This is what most people think of when they imagine going to the doctor's office. The records generated by these visits are known as SOAP notes, chart notes, medrec, etc. They usually, but don't always, follow the SOAP format, which is subjective, objective, assessment, and plan. So, for example, if our patient comes into the clinic with cough and a runny nose, that's subjective. That's the patient's experience of their symptoms. The objective would be the provider's examination of this patient. Maybe they give this patient a flu test. The assessment portion of the note would be the provider's conclusion that yes, the patient has the flu. The plan portion of the note is the provider's treatment plan. So that provider may send that patient home to rest, relax, maybe drink some tea, take some Flonase, whatever that provider may tell them to do. An operative report, on the other hand, is a note that describes a surgery or procedure. Op reports are generally constructed of a header and a body. Different surgeons and hospitals will format their operative reports slightly differently, but they generally all follow a pretty similar format. We also see a similar format, just with different names, for radiology reports, pathology reports, and other services that aren't office visits but also aren't surgical procedures. The header generally always contains the patient's name, date of service, the surgeon's names, and the planned procedure to be performed. The body of the op report often includes why the procedure is being performed, the details of the procedure itself, and any diagnostic findings. Somewhere in the op report will be listed pre and post-op diagnosis, anesthesia details, amount of blood loss, any complications that arose during the procedure, the patient's disposition when they left the operating room, and any post-op treatment plan. These notes are often much longer and more detailed than SOAP notes, but coders who familiarize themselves with these types of medical records and have strong reading skills can do quite well as surgical coders. As I've already mentioned, the basic daily tasks of coders are to read medical records and assign the appropriate procedure and diagnosis codes based on what the provider documented. But this is a pretty simplified explanation. At a deeper level, coders must truly comprehend not only the medical record, which is written almost entirely in medical lingo, but also complex coding guidelines. These guidelines form the backbone of the how and why behind selecting specific codes. Without a strong background in guidelines, even people who have been coding for years may continue to struggle. While there are, of course, many skills that student coders can and will learn through training, there are several important skills that students should bring to the table before they start their journey. Excellent reading comprehension skills are a must, along with attention to detail. There's very little room for misinterpretation or other errors, and mistakes caused by poor reading skills or inattention can lead to denied claims and lost reimbursement for the clinic. The ability to solve problems and think critically is another important soft skill that can help coders understand complex coding guidelines and scenarios. During busy periods, coders may have a lot of medical records to work through, so good time management is crucial. Communication skills, especially written communication, is also a vital part of a coder's workday whenever they need to query a provider for additional details in unclear medical records. In addition to soft skills, there are some hard skills that will be incredibly beneficial for students to develop early on. While there are plenty of training programs out there, these first two skills can be learned on your own. Medical terminology and anatomy knowledge is crucial to read and understand medical records, communicate with providers, and select the correct codes. Students who don't already have a healthcare background are highly encouraged to take a college-level anatomy and terminology course before learning medical coding. It will make coding much easier, I promise. Computer skills are also important since most revenue cycle work in the modern clinic is performed on computer systems. Students don't necessarily need to take a course in EHRs or other revenue cycle software, but they should have basic computer literacy skills. Once a student has these skills down or is actively working to improve them, it's time for them to consider a medical coding training program. A good, comprehensive training program will teach students the differences between code sets, such as CPT, ICD-10, and HCPCS, as well as how to use the books, locate and interpret guidelines, and how to select codes when faced with complex medical cases like surgeries and other major procedures. There are lots of different options to choose from when it comes to training programs. You should first consider how you learn, whether you're an independent learner or if you need more support from your instructor. Next is to consider your schedule. Many training programs nowadays take into consideration that most students are working full or part-time jobs as they study, so classes are often scheduled during convenient evening or weekend hours. If those times still don't work for you, you may consider a program that offers recorded lectures so you can work on the course on your own schedule. Of course, you also need to consider which credential you'd like to earn, whether that's the CPC, CCA, CCS, or another entry-level credential. The course you choose should offer curriculum based around that credential. And the question that's often the most important to many students is what you can afford. A high-quality, comprehensive training program taught by qualified instructors won't come cheap. While you may be able to find inexpensive books and classes on the internet, these materials often lack key information. As a student, you won't know what you don't know, not until you use up a costly exam voucher. Don't waste your time and money on cheap training and allow yourself to get discouraged when you don't achieve your credential the first time. Many top schools offer financing or payment plans to allow more students to access their high-quality programs. By registering with one of these schools, you'll be much better prepared to pass your credential exam the first time and achieve a higher paying job much quicker than students who choose low-cost training options. There are lots of different options online and in person to choose from when it comes to comprehensive training programs. No matter your learning style or schedule, there are plenty of high-quality programs out there that can meet your training needs. Online programs are great because there's no commute time and you can access your coursework and lectures from anywhere. No need to worry about missing class because your boss asked you to stay late. Just watch the lecture recording. Want to go on vacation? Read a few chapters on the beach or complete a quiz on your flight. Live online training programs combine the best of both worlds, the convenience of online coursework with the immediate support of a friendly instructor. The CPC training program by A Plus Revenue Cycle Training is our most comprehensive medical coding training program and can be completed in as little as 4 months. Whether you want to sit in on live lectures or study on your own schedule, you'll have access to watch recordings and complete tests and quizzes 24/7. Our program is taught by AAPC certified instructors like myself, using curriculum created by the same AAPC team that created the CPC exam. Because we don't want you to simply pass the exam, we also include a virtual internship program to all enrolled students with no additional requirements or cost. If you're interested in learning more, click the link in the description or visit aplusrevcycle.com. Now, once a student completes training and is ready to enter the workforce, there's a lot more roles out there than you might think. Let's look at the career paths a coder can take. Entry-level coders are generally going to start out as professional fee or pro fee coders working in clinics. Most students start with their CPC, CCA, or CCS certifications. However, the CPC is the only nationally recognized certification, as are all other certifications offered by AAPC. Coders can branch out from here to more advanced roles, or they can add additional certifications to prove their knowledge in one or more medical specialties. These specialty certifications offered by AAPC can help boost earning potential. Coders who wish to advance their skills beyond pro-fee can consider outpatient and inpatient hospital coding, risk adjustment, auditing, and more. Typically, inpatient and risk adjustment coders, as well as auditors, earn the highest salaries. Alternatively, there are plenty of coding adjacent roles that still utilize the same skill sets, such as cancer registrars, consultants, and educators. Some coders find that they can shift to these other roles in as little as 5 years. Here's a chart from the latest AAPC annual salary survey. As you can see, the average salary for someone with a CPC and no other credentials is over $67,000 a year. Now, this is the average, not the starting salary, but it's still possible to increase your salary substantially in a few short years. In 2017, I was making just $13.50 an hour. And by 2024, I was making more than double that at $31 an hour. In between, I increased my salary not by asking for or working hard for raises, but by constantly seeking new opportunities. Between 2020 and 2024, I never stopped applying for other jobs. I always had a full-time job during that time, but by always hunting for new opportunities, I jumped from making $25,000 a year to $65,000 a year. These huge jumps in income have been life-changing, and it's all because I kept applying, kept interviewing, kept my eyes open to new roles. Whether you're deciding on your first career out of high school or looking to switch careers, medical coding is a stable and rewarding role that comes with an extensive career path. You can make an impact in your community by working with a local clinic or hospital, or enjoy the flexibility of working remotely from home. No matter your background, with a little motivation and hard work, you too can become a medical coder.